My name is Ana Hernando, and I am part of the research team of the TASTY trial. And after these wonderful presentations, we will have the opportunity to finish off the webinar showing you the first results of our TASTY trial. So the study is ongoing. Currently, we have a study sample of 33 participants. 27 have finished, and we still have 6 which are currently ongoing. Here in the timeline, we can see that most of the participants are achieving the end of the study. So we'll soon have the 33 completed participants. Our first results are based on a baseline analysis. This analysis included 27 patients. 96% were women with a mean age of 61 years old. For this analysis, we evaluated the disease activity of rheumatoid arthritis. We also evaluated the functional status of these patients and the body dry lean mass and the gut inflammation. In order to measure disease activity, we used a validated disease activity score, which evaluates the number of tender joints, the number of swollen joints. We also use a patient's global health assessment, which is a score that patients give to their own disease. And lastly, the score also uses an inflammatory marker, which is present in the blood. To evaluate functional status, we also used a health assessment questionnaire, which is a validated questionnaire for this purpose. We used body dry lean mass, and it was evaluated using the bioelectrical impedance analysis. And to measure gut inflammation, we used fecal calprotectin levels, which is an inflammatory marker present in our feces. So what these first results showed us were that gut inflammation was positively correlated with disease activity and with the disability levels. What this means is that in the participants that had a higher disease activity, they also had higher gut inflammation. And in those that had higher gut inflammation, they also had a higher disability score. We also found out that gut inflammation was negatively correlated with body dry lean mass. This means that in those that had a low body dry lean mass, they also showed a higher gut inflammation. Lastly, we also observed a trend towards statistical significance between disease activity and dry lean mass. This means that there seems to be a trend that in those that have a higher disease activity, they also have a lower body dry lean mass. However, this didn't achieve a significance power because it was based on a very small sample size.
Okay, now after this baseline assessment, where we basically looked for associations for patients when they entered the study, we are now on to analyzing the patients that have finished the trial. Although we have included more patients, we haven't conducted the analysis on all of them. So our sample that we had available for this analysis was of 11 patients, mostly women, 91%, with a mean age of 62 years. And they were evenly distributed between the intervention group, which is the med diet group, and control group. So for this analysis, we evaluated also disease activity, but with a different score. So this trial used Doppler ultrasound score, so not the disease activity score, is a different measure, but we also used the patient's perception of their own disease, which is the patient global assessment. And for inflammation, we used a blood biomarker, which is the serum C-reactive protein. And we also evaluated nutritional status through the body mass index. So with these variables, we found that disease activity through Doppler ultrasound scores were not significantly associated, or we didn't see differences between baseline and 12 weeks, although we see that patients mostly had a higher scores at the beginning and lower at the end when we look at the intervention group, and you can't see that in the controls. But when we put these data together, we couldn't see statistical significance for the ultrasound scores, but we found for the patient global assessment, meaning that patients actually felt better at the end of the trial in the Mediterranean diet group, but not in the control group. But we couldn't see differences for the ultrasound scores. So we went on and did a different analysis where we, instead of looking at the raw data from the scores of the ultrasounds, we basically created a new variable, which is just a value where we basically want to show the difference between the end of the trial and the start of the trial. So in the Mediterranean diet group, you can tell that patients had a negative score reflecting these changes, meaning that at the end of the trial, they had lower scores comparing to the beginning, and you couldn't see the change in the controls. So there were significant differences between groups. So being in the Mediterranean diet group actually had a change, and in the controls, you couldn't see better results. And this happened not only for patients' perception, but also for one of the ultrasound scores, which is very interesting. And then when it comes to inflammation, we found that controls at the beginning of the trial had lower inflammation scores reflected by this C-reactive protein. And at the end of the trial, inflammation actually increased. And in the Mediterranean diet group, we can tell that even though in the beginning they actually had somewhat of higher scores, they managed to decrease by the end of the trial, meaning that inflammation improved in the Mediterranean diet group, but not in the controls. And when we look at nutritional status, we found that patients in the control group didn't have any change from the beginning to the end of the trial, but we definitely saw a decrease in BMI in the Mediterranean diet group, where they almost all entered the trial being overweight or obese, and they managed to lose weight, and we could not see that in the controls. So we saw differences in inflammation, in nutritional status, and also in disease activity measures. To conclude, early insights from the TASTY trial actually suggest that the Mediterranean diet can impact nutritional status, a degree of disease activity and inflammation, which sustained the interest in keeping this trial ongoing. So this is our team. We want to thank you for your attention, but also thank everyone that's involved. So these are all of us, but also all the professionals in the rheumatology department at our hospital that help us with recruitment, our lab partners, obviously our patients, and our funding entities. Thank you.